So you've been selected for a random drug test and they tell you to report to the collection site immediately? Now what? Hi, my name's Mike, and I'm with Health Research Systems. We've been in the drug testing industry for over 28 years, and we're doing these short videos so employers can utilize them in a daily safety meeting or settings where time is short in order to still get the information out there about the company's drug-free workplace program. And this is video number 5 in our employee-employer training series, and today we're going to talk about what to expect when you show up for your drug test. Whether you're going for a pre-employment, random, or reasonable suspicion test, the process will be exactly the same. The collection site will have a strict process that they adhere to, which includes the following steps. Step number 1, when you arrive at the collection site, you're probably going to sign in at the desk or you're going to report to your employer representative and a collector will be assigned to you. This is the person who instructs and assists donors at the collection site and receives the specimen provided by the donor. This site may be at your place of employment or at another facility like a doctor's office. The collector's responsibility is to maintain the integrity of the collection process, ensuring the privacy of the donor, and ensuring the security of the specimen. The collector should have identification with his or her name and his or her employer's name, address, and telephone number on it. Step 2. You'll be taken to a secure collection area where all belongings, except for your wallet, are locked away. The collector will ask you for a valid picture ID and record your info on the COC or chain of custody form. You'll be provided with or asked to select a cup in which to provide your specimen. Next, you'll be required to provide a sample before you leave or risk receiving a refusal to test, which we'll discuss later in the video. Step number 3, providing the urine sample. Next, you'll be asked to wash your hands, then all the water is turned off and all cleaning products, fluids are secured. Unless direct observation is required, as in a return to duty or follow-up test, you'll be given privacy during the collection process. The direct observation collection procedure, although it's infrequent, is much more intrusive and includes an observer or collector that is the same sex of the donor that must check the employee for prosthetic or other devices designed to carry clean urine and urine substitutes into the restroom. And they must watch the employee urinate into the collection container. The observer or collector will request the employee to raise his or her shirt, blouse, dress, skirt, whatever's appropriate, above the waist, just above the navel, and lower clothing and underpants to mid-thigh and show the observer by turning around that the employee does not have such a device. At that time, the employee is permitted to return clothing to its proper position for the observed collection. The observer must watch the urine go from the employee's body into the collection container. The observer must watch as the employee takes the specimen to the collector, and the collector then completes the collection process. Step number 4, observing the sample preparation. When you're finished giving your sample, you will hand the container to the collector, who will check the temperature on the collection cup, and then split the sample between 2 different containers, and you'll return to the desk or area where your paperwork is being completed, and the collector will seal them with a tamper-evident tape. You will observe this process and sign each piece of tape before you leave the collection facility. It's important that the urine sample never leave your site during this process. Step number 5, providing contact information. Next, you'll be required to verify your name and date of birth, as well as to provide your contact information. This ensures that a medical review officer, or MRO, can get in touch with you to discuss your test results if needed. Step number 6, paperwork and samples are then prepared for shipping. Your sample and paperwork will be placed in a leak-resistant bag or container and sealed for shipment to the laboratory. Once the collection process is complete, you'll be given a copy of the chain of custody form and your sample will be sent to the lab for analysis. The results will then go to the MRO for review. Depending upon the initial results of your test, they may contact you to discuss recent medications or other possible explanations for a positive test. Step number 7, know your rights. If your sample comes back positive, you do have the right to request a second test using the second bottle of urine or the split specimen that was prepared at the collection site. This request must be made within 72 hours of speaking with the MRO about your test. I mentioned earlier, what if you can't provide a sample? Once you go to the collection site, you must provide a sample within 3 hours or risk a refusal to test. If you're unable to provide at least 45 milliliters of urine, you'll be asked to remain in the testing area until you're prepared to give a full sample. While you wait, you'll be given the opportunity to drink up to 40 ounces of fluids in preparation for your second collection attempt. And if you still can't go, be prepared to have a medical evaluation to determine if there is an appropriate reason why you weren't able to provide a sample. If no legitimate reason can be determined, you'll be given a refusal to test. That's our training for today, and we look forward to working with you to have a safer, more productive workplace. This is Mike with Health Research Systems, and we offer national drug testing programs and background checks to companies of all sizes. If you have any questions, you can email us at info@healthresearchsystems.com. That's info@healthresearchsystems.com. Hit the like and subscribe button so you'll know when we release the next video in this training series. Thanks for watching.